Hello and welcome to In Case You Missed It. Today is Friday, January 9th, and guess what? We got movement on subsidies. I told you this is going to be the biggest topic of the year. It will continue to be. But just today, the House, the lower chamber, voted 230 to 196 to pass a 3-year extension of the COVID era Obamacare enhanced subsidy. So this would just kind of keep going forward what was already in place. It would go back to January 1st. It would reopen special enrollment period windows for people that qualify. And what was very interesting is there was 17 Republicans that joined Democrats in passing this. Just yesterday, they had a procedural vote that didn't get anything into law, but it gets an idea of where everybody stands. And only 9 Republicans were on board yesterday. So the momentum is shifting. It shows that House Republicans feel very vulnerable in the upcoming midterm elections and need to have some sort of win on healthcare. So that's good. Now, unfortunately, Senate Majority Leader John Thune has indicated he will completely ignore this bill as it reaches the upper chamber. They got one of their own cooking. The House bill over a 3-year period would cost $80 billion. And the shift of them taking it on really shows you how interested these Republicans are in getting the dub here ahead of the midterm elections. Now, in the Senate, there is a bipartisan deal emerging that would extend these subsidies for 2 years, not 3, and put income caps on it. So they would have a little bit more restriction for people in the higher end of the subsidy eligible class, and they would eliminate any $0 premium plans. So they want to make everything at least $5. Many critics of the subsidies claim the $0 thing is wrought with fraud, and many people are enrolled in those plans that don't even know about it. So a $5 monthly price tag would be the lowest price tag out of the Senate. They would also give people the option to get health savings account or credit dollars in account to spend for medical expenses, as opposed to help with premium assistance. So what this means is we are seeing major movement ahead of the next government deadline, which is at the end of the month. So you will see some movement on these subsidies. Sounds like over the next week or so. We might be back here next week talking about how we have a deal. So more to come on that. Now on to a topic we're all familiar with, alcohol. So the long-standing report from the Centers of Medicare and Medicaid Services has always said that no more than 1 drink a day for females and 2 drinks a day for males is the most you can have and still have a healthy lifestyle. That's the max you should be drinking in a particular day. Okay. Now they have Dr. Oz has come out and said, hey, listen, everybody, you're grown-ups. You don't need these kind of restrictions. How about our new directive is not a number of drinks per day. How about this? How about consume less alcohol for better health? That's the max. That is what has happened now. So there's no more 1 drink, 2 drink type of thing. It's just like, hey, man, y'all are grown-ups. You can do this. Well, we're not all grown-ups, so hopefully this goes okay. But now the restrictions on what is healthy has been lifted. Basically, Dr. Oz has said, not basically, actually, Dr. Oz has said that he views or understands that alcohol is a social lubricant, and people being social and hanging out in groups creates happiness, which can also lead to healthier outcomes in life. Utah becomes the first state to allow artificial intelligence to automatically approve prescription drugs. Now, this is not going to be the whole range of prescription drugs, really the more routine prescription drug refills that need to happen. So they are going to start partnering with a company called Doctronic, who will use Utah as the first state to approve these things. Texas, Arizona, Missouri right behind them, and Doctronic CEO seems to think that there'll be at least a dozen states by the end of 2026 that are adopting their artificial intelligence or something like that to make more efficient the prescription drug refills. Health insurance executives are being called to the principal's office. House GOP members are asking the leaders of some of the more major medical insurance companies, Aetna, United Health, Blue Shield of California, are some of the ones being invited on January 22nd to sit down and discuss affordability of their products to the American people. Now, Republicans believe that the problem is not just around the 20 million or so people that are getting these subsidies. That's where the Democrats have been focusing. Rather, House Republicans want to start talking to insurance companies about the 160 plus million people on commercial plans through your employer. Why is that so expensive? So they'll be answering to that. Democrats pan this whole thing and say it's just a facade, something to get good stories out there through PR, and they're just going to all talk about it. Nothing's going to happen. Republicans say this is a bigger problem than just subsidies. So we'll see how that goes on the 22nd. Johnson & Johnson is the latest in big pharma to reach a deal with the Trump administration on lowering drugs for certain medications. This is the Trump directive to give us most favored nation pricing. So Johnson & Johnson's on board. Now, the problem with some of this is these deals are made very public, and a lot of people believe this is a matter of PR for the Republican Party trying to get a win before the midterm when they've been taking nothing but L's on healthcare. So we're hearing a lot of this drumbeat of announcements that prescription drug manufacturers are agreeing to lower prices. But the thing is, they have agreed to lower prices at some point on some drugs at some time for some people. Okay. So it's not going to be an overall measurable impact to your family's income, although we will be finding some stories of prescription drug prices going down. And finally, California ends Medicaid coverage for the GLP-1. So Medicaid recipients are no longer going to be able to receive Ozempic, Wegovy for obesity. It'll still be available for type 2 diabetes and treatments such as that. But California, along with several other states, citing Medicaid cuts and cuts to overall budgets as the reason why they have to cut these very popular but unfortunately expensive GLP-1 drugs as a matter to tighten their belts and afford the coverages being offered for the reimbursements coming from the federal government. Thank you for stopping by. See you next week.